Let's learn about human rights and mental health. 1 in 5 adults in the United States experience mental illness in a given year. The stigma against mental illness prevents people from being able to access services because of the idea that it is somehow different from other kinds of illness such as asthma, cancer, or a broken limb. Let's talk about the Universal Declaration of Human Rights and how it relates to mental illness. The Universal Declaration of Human Rights is an international agreement made in 1948 by every country in the United Nations that defines the basic rights of all persons. Let's talk about some key articles that relate to mental illness, such as Article 2, the right to non-discrimination. Quote, "Everyone is entitled to all the rights and freedoms set forth in this declaration, without distinction of any kind." Article 3 says that everyone has the right to life, liberty, and security of person. Article 25 says, quote, "Everyone has the right to a standard of living adequate for the health and well-being of themselves and their family, including food, clothing, housing, and medical care, and necessary social services, as well as the right to security in the event of unemployment, sickness, disability, widowhood, old age, or other lack of livelihood in circumstances beyond their control." Now let's talk about where these rights have been violated when it comes to mental illness. Article 2, the right to non-discrimination, has been violated because people with mental illness face discrimination in all areas of life, including employment, education, and the right to shelter. For instance, the British Psychological Society says that there is a racial component to accessing services. Numerous studies have found that Black patients are less likely to be referred for mental health services. Article 3, the right to life, has been violated because the life expectancy of those who experience mental illness is lower. For instance, the median reduction in life expectancy among those with mental illness was 10.1 years across 203 studies from 29 countries by the National Institute of Mental Health. This is a predictive factor in shorter life expectancy because of lack of treatment, stigma, as well as the tertiary impacts such as homelessness, drug addiction, and wrongful imprisonment. The right to health, medical care, and social services is also impacted in mental illness. There is a lack of mental health resources, socialized healthcare, and facilities, and this has a big impact. The World Health Organization reports that 30% of countries don't have a specified budget for mental health. Of those that do, 20% spend less than 1% of their total health budget on mental health, meaning that access to care is far from universal. Additionally, approximately 26% of homeless adults staying in shelters live with serious mental illness, according to the National Alliance on Mental Illness. The lack of social services, such as shelters, further marginalizes people with mental illness. This is a mental health timeline, which talks about the different approaches to mental health, starting in the 1840s, where it was categorized as idiocy and insanity. Then, coming into the 1920s and 1940s, we see that asylums, inpatient hospitals, electroconvulsive therapy, and frontal lobotomies were characteristic of mental health treatment. And finally, mental health today. Mental health today is viewed as a personal failure instead of what it is, an illness. Often the stigmatization and discrimination prevents people from seeking treatment. It impacts their lives in negative ways and has far-reaching impacts on all of society. Let's talk about some policy interventions we came up with to address the issues of mental illness. 1, we can integrate mental illness education and destigmatization efforts with existing health education in public schools. The pros is that it reaches younger generations with a systemic solution to promote health access from a young age. The cons is that it may require statewide policy change in order to implement reforms. 37% of students with a mental health illness, age 14 and older, drop out of high school. Another policy we can enact is creating mandatory mental health education and sensitivity awareness training for all city officials, contractors, and public servants. The pros is that this promotes competent care for people working with vulnerable populations, as well as a culture of trauma-informed service. The cons is that there is a costly implementation requiring a lot of expertise. The jail population in Spokane dropped from 1,200 in 2009 to 700 in 2010 as a result of increased mental health services. What can you do to help? You can follow these steps if you care about mental illness, and you can address them by just taking a minute to share this video, by engaging and advocating, and knowing and sharing the number for the first call for help. Now let's talk about the short-term plan for integrating marginalized individuals into the greater society. Short-term, we can enact interventions on an individual, community, city, and statewide basis that promote destigmatization, create services, and reduce the tertiary effects of mental illness. This can look like on an individual level, being open about your own mental illness. On a community level, this means supporting family and friends who are struggling and recognize the intersection of mental illness, homelessness, addiction, and imprisonment. And on a city or state level, supporting mental health services and joining organizations that advocate for mental health. Long term, we need a nationwide push towards better policy that fills the gaps where states and municipalities fail to meet the needs of individuals in a dual cultural and rights-based legal approach. We can look to the Australian model of mental health intervention in order to see different policies that can make a huge difference, such as amending state and territorial mental health legislation to protect the rights of people with mental illness, launching a national media campaign to increase understanding of mental health and reduce stigma, and including carers and consumers in all working groups dealing with national issues of mental health programs. These are our sources. Thank you for watching.